And we are live. It's Dr. J here in the house. Today we're going to do a nice live Q&A session followed by an opening video chat. We're going to be chatting about celiac disease diagnosis, kind of what it looks like and why it may not be enough. Before we dive in, make sure you smash that like button. It really helps. Put your comments down below what you think about the video, your experiences with celiac disease or gluten sensitivity. And feel free to share to friends or family. Make sure you hit the bell as well so you get notifications of new videos coming your way. So off the bat, what is celiac disease? So celiac disease is the pathological expression of a gluten allergy. So when you have a gluten allergy, right, a severe allergenic response to gluten, you're going to see what's known as microvilli thinning. So the little finger-like projections in your small intestine, they're called microvilli. When you start to see it atrophy or thinning, typically about 80%, that's usually a hallmark diagnosis, an endoscopic diagnosis of celiac disease. You can also do these capsule endoscopies that take pictures, that you can see it via that. They're doing the typical endoscopy and then the capsule types of endoscopy as well. There's also different blood testing that can be done. The big ones are going to be transglutaminase or endomysial antibodies that look at the endomysium, the outside of the nerve being attacked, or they're going to look at the transglutaminase, which is a translational enzyme that helps with the villi and the gut. So when we start to see endomysial antibodies, transglutaminase antibodies, and also we may even see deamidated gliadin. Deamidated gliadin is another hallmark for celiac. Now, a lot of people that are sensitive to gluten may not express with those specific antibodies or the specific damage in regards to the microvilli. Now that's where, okay, now what's going on, right? So there's other testing that you can do, such as HLA-DQ testing, which is genetic testing, and the hallmarks are going to be HLA-DQ 2 and 8 for gluten, for celiac, but it just tells you a genetic predisposition, meaning you could have 2 or 8, you may not have celiac, but you could still be expressing with severe gluten sensitivity, meaning you don't have the hallmark damage or antibody expression, but you don't feel good when you have gluten, and that's really the hallmark. So HLA-DQ 2 or 8 is also 1, alpha 1, beta 1, and 3 give you other markers for gluten sensitivity regarding the DNA testing. So this is really important because if we have this level of expression, we want to make sure that we're on top of it. Now, my ultimate hallmark is I've seen lots of people that have issues with gluten and that may not be celiac. So one of the things we do is an autoimmune elimination diet where we pull out all the known autoimmune foods, all gluten, not just grains, but all not just gluten, which is typically wheat, and then kind of barley and rye got lumped in there. So typical gliadin is the major protein that we know as gluten, right? They say gluten, they really should be saying gliadin. Now, barley and rye got lumped into the gluten camp. Okay, so wheat, barley, and rye really are the gliadin gluten camp. But the problem is we have other types of proteins or gluteolins or similar types of prolamines that are like cousins and brothers and sisters of gluten, such as horsenin, which is rice, avenin, oat, zein, corn, right? Sorghum, right? All these other types of proteins. So we want to cut all of them out. We want to cut all grains out. Grains are nothing more than the seeds of grass. And they are all similar, just like there's a family resemblance. Well, there's a family resemblance when it comes to glutens and prolamines. So we want to cut those foods out. And what we typically see on an autoimmune elimination diet is major, major improvement. Now, one of the things I'll also run too on my gut testing, we'll run anti-gliadin antibody as well, but we'll run it in the gut because sometimes the antibodies may not make its way into the blood, but we'll see it in the stool because that's where the gluten and your immune system is interacting, because 80% of your immune system is in the gut. And if you see the antibodies in the stool, that's kind of a first response to where that antibody reaction is happening. So if we see that present, that's great. The problem is if you're already on a diet that's cut out all grains, so not gluten-free, but grain-free. Gluten zero, grain-free is ideal, but also autoimmune to cut out the dairy, which could also give you a false positive, potentially eggs, nuts, seeds, nightshades, etc. Those are kind of our autoimmune template. No grains, legumes, dairy, nuts, seeds, nightshades, and or eggs. That's a really good starting point to make sure the diet is solid. And I've seen many people who have gone to their conventional gastroenterologist did the, enteroscopy, endoscopy, did the capsule endoscopy, nothing showed up. Did the typical transglutaminase, endomysial antibodies, did the anti-gliadin in the blood, may have even done deaminated gliadin. Nothing came back, but we see a major benefit by changing the diet. Some also say it could be the fermentable carbohydrates in the grain, FODMAPs. It could be other things like glutalins, which are similar. It could be other anti-nutrients that are irritating, that block up minerals, oxalates, phytates, and other anti-nutrients that could be irritating the gut. So there's a lot of potential underlying causes of why gluten may be an issue, even though it's not the direct issue, right? All right, hope that helps so far. I'll feel free and answer some questions for y'all if they're coming in. Couple questions that came in here. Is hemorrhoids and rectal bleeding linked to SIBO? Yeah, it can be, because how does rectal bleeding happen, right? Rectal bleeding or inflammation of the hemorrhoidal veins, right, in the rectum or anus, they're going to happen from inflammation in the intestines, okay? There could be an autoimmune component like an ulcerative colitis, which is the autoimmunity of the colon kind of getting ripped up by your immune response. Could also be motility is messed up from the inflammation and from the gases produced by bacterial overgrowth, which could cause, an additional needing to bear down more when you go to the bathroom and pass number 2, which could create more pressure on the bowels and could inflame those veins. So yeah, definitely possible for sure. Does Crohn's disease relate to brain fog? Yeah, anytime you have an autoimmune issue, autoimmunity, where there's all these antibodies that are attacking tissue, the inflammation in the gut, which is, Crohn's disease is a manifestation of autoimmunity in the gut with skip lesions. So usually you have these, good tissue, inflamed tissue, good tissue, inflamed tissue, and it kind of is like a zebra stripe in the intestinal tract. And usually it's going to be small intestine into the colon, where the other type of irritable bowel disease, which is ulcerative colitis, is primarily just in the colon and doesn't do the little zebra stripe thing. What helps with memory loss? So getting the inflammation down. So in regards to gluten sensitivity or celiac, that's going to be a big component. Inflammation in the gut creates inflammation in the brain. Inflammation in the gut creates inflammation in the brain. Really important. Let's hit up Facebook. Any questions here? Thank you, Chantel. Appreciate it. Glutalins are a class of prolamine-like protein compounds that are found in the endosperm of certain seeds of the grass family. That's correct. Yep, a major component of protein composed collectively referred to as gluten. Explain how this is different than gluten or is the same thing. Glutalins are very, very similar. So when I look at glutalins, that's kind of in like the anti-nutrient category of grains. So I look at gluten, which is in the prolamine category. So it's a little bit kind of getting in the weeds, so to speak. Dr. Peter Osborne's done a couple of videos kind of looking at the difference of those. But you have essentially gluten, right? Which would be, in the case of wheat, would be gliadin, right? And then you have potential glutalins over here, and then you have other things like phytates and oxalates and other anti-nutrients. So I put it more in the anti-nutrient category, but it's very, very similar though. Great question. Last 2 endoscopies show normal to no gastritis, but still symptomatic. How is this possible? So we need functional testing to look at what's happening. So if they're just looking at gastritis or inflamed tissue, it'd be good to have antibody markers or calprotectin markers to know if there's inflammation happening. Also, where was your diet at? Were you doing a provocation diet at the time, or has your diet been clean? Also, infections will not be found on an endoscopy. So if there's other infections that are going on there, or there's just poor digestion, all those things could potentially be a problem. So that's the thing. I see many patients who have gotten the thumbs up from their gastrointestinal doc, which is great. I like that, because then I'm like, okay, cancer, major irritable bowel disease, ulcerations. It's kind of like, all right, that's off my plate. I don't have to worry about that. But then now we have to dive in deeper, and that can get missed a lot. Desiree writes in, hey Desiree, we'll do a coffee enema once a week to disrupt hormonal pH of the colon and also bacteria. That's a great question. I think if you're doing it for detoxification, like you're doing once a week, I think that's probably fine. I typically only recommend coffee enemas if there's really a more severe reason to detoxify, such as cancer or such, just because that is the big thing that I am concerned about, is disrupting colon pH and disrupting bacteria in the colon. I'm more concerned if you're doing like water enemas daily to have to move a bowel, right? That's not good because you'll just definitely disrupt the pH and potentially electrolyte absorption. A lot of electrolytes are reabsorbed in the colon. So if we're constantly putting water or coffee up there and flushing things out, that's going to affect reabsorption of minerals. But I think as long as you're kind of on top of your diet and you're doing a really good job and you're getting extra electrolytes in afterwards, you'll probably be okay. But just keep an eye on how you feel and your regularity and those kind of things, and make sure you're stable there. Great question, though. But with a coffee enema, you're not doing it. People listening, coffee enemas are not done to move your bowels. They're moved so the coffee goes up, hits your liver and gallbladder, which then dumps a lot of toxins into the coffee, which is now in the small intestine, and it also increases internal endogenous glutathione production. So a little bit different. Coffee enemas are done to move the bowels. Water enemas are done to move the bowels. Coffee enemas are primarily done not even to have to do with the bowels, but more to increase glutathione production internally and to help the liver dump toxins. Great questions, everyone. Got my thyroid checked and had low TSH, but my T3 and T4 levels were normal. Got it checked from bad brain fog as a result of gut issues, potential link and advice on improving TSH. TSH was low, T3 and T4 were normal. I need to know exactly what the numbers were. As long as it wasn't below 0.3 or so, it may not be a problem. I like to have exact numbers if I'm going to give you specifics on that. Hey, you're welcome, Martin. Thank you. Dr. J, is a supportive for body detoxification system. What would you prefer, glutathione or NAC, and at what doses? It just depends. If we're more sick or have severe detox issues, I'd probably jump on board with glutathione. If it's more maintenance detox support, NAC would probably be okay. Great. How can I treat rectal bleeding and constipation if I'm drinking a lot of water and eating enough fiber? Well, you'd want to follow the 6 R's. Make sure you're removing the bad foods. Make sure that you have enough enzymes and acids and bile to break down the foods that you're eating. And number 3 is make sure you're supporting the inflammation in your intestines and the gut barrier. Number 4, make sure you're removing any infections that could be disrupting the gut, disrupting motility, and then repopulating with good bacteria. So we need a lot more data to know if we're addressing the whole issue. Okay, great. Great question, y'all. All right. Anything else, guys? Let me know. If not, I'm going to go fire up my grill. I'm going to cook a grass-fed organic ribeye tonight and some steamed broccoli. It's going to be fabulous. All right, guys, I'll be back hopefully tomorrow. I'll try to jump on here if I have time. You guys have a phenomenal day and take care. Make sure you subscribe, comments down below. Take care. Bye.